1 in 3 people with confirmed Sjogren's disease test negative for the standard antibody tests. 1 in 3. If your labs came back normal, but your body says otherwise, stay with me because the test your doctor used may not have looked closely enough. Hi, I'm Dr. Carol Wada, a quadruple board certified allergy, immunology, lifestyle medicine physician. I also live with Sjogren's disease, and I understand what it feels like to have symptoms and lab results that don't quite make sense together. I know what it's like to live on both sides of the exam room. This week, seronegative Sjogren's came up more than any other topic across YouTube, Facebook, Instagram. 8 separate posts, dozens of comments, the same question over and over. My labs are completely negative, completely normal, but I have every symptom on the list. Does that mean I don't have it? And today I'm answering that question. Save this before your next appointment. All right, let's get into it. On a quick note, this is not medical advice for individual situations. This is educational, and these are the patterns that I see clinically and what the research supports broadly. Before anything else, that number again, somewhere around 30 to maybe even 40% in some studies of people with confirmed Sjogren's disease test negative for the anti-SSA or Rho antibodies. That's the standard test, the test that I was tested on to take all of those board exams, and it's the one that most rheumatologists rely on. This isn't a rare, case that folks have normal blood work. It's not an anomaly. It's somewhere around 1 in 3 or even fewer patients with a confirmed diagnosis would have walked out of a standard lab appointment being told their results are normal. If that is you, you are not imagining it, and you're not unusual, and you're not alone. So what does seronegative actually mean? And what is Rho 52, Rho 60? What's this distinction? All right, seronegative means that your blood work is normal. Sero means blood work, or serum. Negative means nothing's there, normal. In particular, we're talking about SSA antibodies. They did not show up on blood work, and that is essentially the whole definition. But it doesn't mean that the disease process and inflammation is not there. So what does the research show? Seronegative patients have the same core immune process as seropositive patients. They have inflammation in their salivary glands. They have changes in their interferon pathway activation. They have similar patterns of immune cells infiltrating tissues. The biology is present. It's just that the antibody, or this blood test, is not showing up on the results when we look for it. So here's something most patients, and honestly many of my colleagues, don't know. When your doctor orders an anti-SSA test, they're actually ordering a test that looks for 2 completely different antibodies, anti-Rho 52 and anti-Rho 60. Most standard lab reports report them as one combined result. It's a single number, it's positive or negative, and sometimes there is a distinction as to how positive it is. That's called a titer. And when we look at titer results, that will show up like a ratio. So it'll be 1 and then a colon to 40, 1 to 80, 1 to 160, 1 to 320, so on and so forth. The higher that second number is, the higher your level is. So it means that when they were in the lab and they had to dilute out to see how long that test would say positive, there was more of the antibody present, so it showed up the more dilute that became. All right, so what's the difference between anti-Rho 60 and 52? Anti-Rho 60 is the antibody that is most strongly linked to seropositive Sjogren's disease. Anti-Rho 52 has a broader immune signal across multiple autoimmune conditions, but these two are often lumped together. And we also can see that this test can just be normal or negative even when disease-relevant inflammation is present. When your doctor says SSA came back negative, you can ask if there was any distinction between Rho 52 and Rho 60. Were those measured separately or the same? And we're going to give you some more things to ask about too. Newer testing platforms do exist now that will report these separately, so it's worth asking your rheumatologist about these. The absence of anti-SSA on a standard combined test does not rule out Sjogren's disease, and there is both a serologic pathway and a histologic pathway to diagnosis. Seronegative patients have to often take the histologic route, meaning tissue route, and most aren't really told that this exists. So, okay, the next part's really important, so stay with me. Here's the paradox of research and what it reveals about seronegative Sjogren's disease. Seronegative patients often carry a heavier symptom burden than seropositive patients. They report higher levels of pain, more fatigue, more peripheral neuropathy, more dental issues and tooth loss, higher dryness scores across the board. But their systemic disease activity scores, the numbers that rheumatologists use to measure how serious disease is, often look lower. Because these scores are partly built on antibody markers that seronegative patients do not have. So the labs look better, the patient feels worse, and that gap is exactly where people fall through. This is why seronegative patients are so often labeled with fibromyalgia. The pain is real, the fatigue is real, the labs just aren't confirming what standard models expect. So the diagnosis defaults to something else: fibromyalgia, chronic fatigue, sometimes anxiety, perimenopause, sometimes nothing at all. And then there's the lymphoma question, because I know that's on a lot of Sjogren's patients' mind. The research shows that seronegative patients generally have a lower lymphoma risk compared to seronegative patients. The classical markers associated with the highest lymphoma risk include low complement levels, cryoglobulinemia, lymphopenia, meaning low lymphocyte levels, and these tend to be less common in seronegative disease. That lower risk, though, does not mean zero risk, and I want you to have an accurate picture rather than a fear-driven one. So what are 2 tests that are worth asking about by name? All right, let's talk about what you can actually do about this, right? If your antibodies are negative, you're still symptomatic, you're still concerned that this is a possibility of, something you might be dealing with, there are 2 specific tests that are worth asking about by name at your next appointment. The first is a minor salivary gland biopsy. This is the lip biopsy. It is a minor or small outpatient procedure, often done with just local numbing medicine. And it takes a tiny sample of the salivary gland from the inside the lip and looks for a characteristic pattern of immune system infiltration lymphocytes in those glands under the microscope. But here's the number I want you to remember. 70% of seronegative patients who get this biopsy will test positive on histology, meaning when they look under the microscope, it will then confirm that condition, 70%. That means the disease is confirmed not through antibody, but through the tissue itself. Often though, seronegative patients are never offered this test because a negative antibody result just ends the conversation. And I'm saying it shouldn't. You should have, these conversations and discuss what your other options are. The second test that you should know about is less invasive. It is an ultrasound of the salivary glands. It's no numbing, no stitches, no procedure, no numbness, no recovering time. It uses imaging, an ultrasound, which does not use radiation, to look at the structure of the salivary glands and identify the characteristic changes that are seen in Sjogren's disease. The specificity is up to 94% in recent studies. It's not necessarily a replacement for biopsy in all cases, but it is a meaningful step that requires nothing more than sitting still while someone puts some gel and scans your jaw. It's worth asking about, especially if lip biopsy may not be available to you or you're worried about the potential risks of a lip biopsy. The question to ask your rheumatologist is, given that my antibodies are negative, has minor salivary gland biopsy or ultrasound been considered as the next step in our diagnostic process? Many rheumatologists are undergoing training for salivary gland ultrasound, and I'm actually headed to get trained myself in the next week as of when I'm recording this, and this will probably go live around the time I'm getting the training. And so it is increasingly available. And so if you're asking about it, well, gosh, this puts this into their mind. This is also helping them, understand. And I realize that shouldn't necessarily be your job as a patient. And also, if multiple patients are asking clinicians for, these modalities, it also it plants the seed. And so when they see an email saying, hey, there's a training in Tampa to get trained in salivary gland ultrasound, maybe they'll think about signing up for it, right? That's in part, my experiences as both a patient and physician wanting to have, I have this extra drive for this, right? But we do listen to our patients. I know it may not sound like that or feel like that all the time, but, keep planting those seeds. Now, I want to do a quick pause because if you are in this situation, if you're trying to learn all you can about Sjogren's disease, maybe you have a diagnosis or you really strongly suspect you have it, the 5th annual virtual Sjogren Summit is taking place this July, and it's where this conversation continues. Our theme this year is Stronger with Sjogren's, and we have already on the docket, I just looked at the list of speakers. We've continued to look through some applications this past week. We have world-class experts. We're going to be talking about new era of treatment. We're going to talk about real tools for navigating a diagnosis that the standard system keeps missing. We talk about the role of, medications and also lifestyle and community support. It's virtual, it's interactive, it's totally free to attend live. And it is just something I'm so excited to be able to bring to everyone for this 5th year. The waitlist is in the description, takes 30 seconds, and I'd love to see you there. Okay, 2 things to do today, that's all. The first is to bring up in this conversation the biopsy and the ultrasound by name. At your next rheumatology appointment, say, given my antibodies are negative, have we considered a minor salivary gland biopsy or lip biopsy or an ultrasound as a next step? You don't have to be combative. You just have to name the test. Most patients, why would you, know to do this? And so this is my call to you. This one question can maybe help reopen up that conversation with your care team and help put Sjogren's back on what we call your differential, or the list of things that may explain what is going on with your health and your symptoms. The second, you can go download our free lab conversation guide in the description. It covers, an ongoing discussion beyond just SSA and SSV and talks about the concept of your immune terrain. When we live with a chronic inflammatory condition, we are at an increased risk of heart disease and certain cancers. And so this is continuing that conversation, thinking about your health as a whole. It's a free PDF. The link is in the description. Before I send you anywhere, I just want to say this. If you have been told your labs are normal while your body has been telling you something completely different, that experience is documented. That gap between this, what the standard tests show and what is happening inside your tissues is real, it's measurable, and it's acknowledged in the research. You're not overreacting, you're not difficult, and you're right to keep pushing. And if nobody has said this to you clearly yet, seronegative does not mean symptom-free. It does not mean disease-free. It means that our current standard testing missed you. And now you know some additional things to ask for instead. So save this video, send it to someone who has been dismissed because their labs came back normal. That is exactly who this was made for. And if this is the content that helps you, hit subscribe. This is exactly what this channel is for. New videos every week, science-backed, not much fluff, a little bit, just because I'm a little bit fluffy. And I'll see you in the next one. Before I go, a few resources are in the description worth bookmarking. That lab conversation guide. And then we also have the Immune Confident Indicator. It's a free 2-minute quiz that can help you get an idea of a starting place of where your immune health currently stands. If you're ready to stop navigating this alone, Stronger with Sjogren's is open for enrollment through May 17th. It is our membership community where we go into this type of content as a small group each and every month. We have live sessions with myself, with my team. We talk about the latest research. We have a community of mostly women, because that's who this disease affects, but a few really great men too, who understand what it's like living with complex chronic multi-system conditions. It also includes access to our fitness app that is put together by my dear colleague and friend, Dr. Ali. Super easy on-ramp to getting yourself back into the habit of showing up and moving your body. Every membership right now also is going to include an all-access pass. You'll have ongoing access to the virtual Sjogren Summit this July and you get access to all the prior ones too. So if you comment SWS below, we'll send you all the details. The link is in the description. Thank you so much for joining. I appreciate your time, your attention, the ongoing conversation in the comments, and I wish you well. Take care.